The people have called Nigeria the poverty central of the world. And the opioid crisis is a manifestation of that desperate level of poverty. Young people trying to cope resort to opioids, including tramadol, to ease the pain.
The UNODC opioid strategy is an integrated response to the opioid crisis. It's a 5-pillar framework that provides member states with a roadmap on how to address the challenges posed by synthetic drugs and synthetic opioids. UNODC is working very closely with its collaborating partners and sister agencies like the World Health Organization to help strengthen prevention and treatment programs around the world.
Where we are right now is our drop-in center, Mabuchi, in Abuja. We cited it here to be able to make it community-based. It's a community-based, non-residential drop-in center where those that are struggling with addiction can come in and have a meal, have a decent place, have a shower, be treated with respect and dignity as they begin to walk the path, and they're given the support that they need in order to reduce and eventually go off their addiction.
This place has been good influence for the community because it's changing lives. Yes, so we love it, and the community also loves it because it helps us change our lives, outputs, and everything.
Change your life?
Change my life. It changed my life greatly.
So with the UNODC EU initiative, it's shedding light to the problem. With all the research, with the conferences, with the education, with the advocacy, it has shown light to something that was hidden and in the dark.
The peculiarity in Nigeria is that the influx of trafficked tramadol has had a huge impact. If you look at the National Survey on Drug Use of 2018 that has just been released, you find that the prevalence of substance abuse in Nigeria is almost more than twice the global average. And codeine and tramadol happen to be the second most abused.
UNODC is looking to change the understanding around substance use disorders, to have member states take more of a health-centered approach to the strategies and the responses they're putting in place to address the challenges that are posed by synthetic drugs and synthetic opioids.
The UNODC's support, it has tremendously helped over time for people to shift their perception of substance use disorders from that of a criminal or moral issue to basically a health issue. And I think that generally has affected and made it easier that we are now moving towards decriminalization.
I see a lot of light in terms of prevention, because the groundswell, the genie is out of the bottle. There's awareness has been raised and people are making the connection. Conversation have started and it's not going to stop.